Democrats are still hammering out their version of a health care overhaul, but Republicans say they have their own ideas. In just about half an hour, House Republicans will unveil what they call a less costly alternative to health care reform. Michigan's Republican Congressman Dave Camp is ranking member of the House Ways and Means Committee. He wrote the plan and joins us now. All right, Congressman, what's this better alternative that you're presenting?
Well, we think it's important to have an American solution on health care, and we emphasize the issues of affordability, accessibility, and availability. And what we want to do is really make it possible for people to be able to buy insurance by getting costs out of the system. And we do that through a very strong oversight on, we know there's a lot of waste and fraud in Medicare and Medicaid, but also a lot of duplication in hospital services. So those are just some of the ideas we have.
Did you just say an American plan? What does that mean? Are you suggesting the president's or the Democrats' plan is not an American plan?
No, we want to make sure that we have a bipartisan solution that really fits the kind of health care system that Americans are used to, which means that you get treatment immediately. One of the reasons we have such a higher success...
Why are you calling it an American plan? I don't get that.
Well, the president has called for an American solution to health care. That it shouldn't be just a Republican plan or a Democrat plan, that it should be an American plan. And that's what we believe we have, one that fits the kind of health care needs that Americans have, the kind of health care system that has been an innovator around the world. We want to keep that. So we have some unique...
But Congressman, how are you going to do that? I think everybody gets that part, that's what everybody wants, some type of bipartisan plan, no doubt. But how do you get those additional 50 million people covered?
We have some unique aspects to American health care that we want to keep. And how we do that is, as I said, we have a very strong and robust fraud, waste, and abuse program. We believe that medical liability reform should be a part of any general overhaul or reform of health care. We also make a lot of administrative changes that make it more possible for small businesses, and that's for a lot of the people who don't have coverage. They're actually working and their employers don't offer it. Making it possible for them to join together, have larger pools of people being covered so they can get lower costs. Those are some of the concepts that we're going to be unveiling today at 10:30, and we think that this is going to be an approach that won't cost more than the GDP of most countries.
Okay, so you're going to be allowing some tax credits for small businesses and people if they or employees of small businesses to buy into these pools of insurance to get insured. That's one part of it. Let me just get a yes or no on this. You do not support a public option as the president is proposing, right?
No, because that will move people out of private insurance. Estimates as high as 120 million people will lose their health care. That's not a good approach.
Two, how much does your plan cost?
Well, this is a summary. We are going to be drafting legislation. That's step 3. We started with principles. We have this summary. As you know, under the rules in the Congress, the Democrats' plans get scored first. We're at the end of the line, but as soon as we get a score on our bill, we'll certainly make it public.
And Congressman, you said you wanted an American plan, which I guess means a bipartisan plan. Is Speaker Pelosi supporting your plan?
I hope so. I think we have a lot of ideas that could certainly be a part of any bipartisan health care bill, if that's the direction that the Congress goes. I think what would be bad if we followed the pattern that was set in stimulus, where the bill was drafted in secret. There really wasn't an ability for the American people to review and get involved. Health care is too important. It's not just about spending money, it's about people's health. We need to make sure that the American people are part of the solution. They fully know the ideas that are out there. That's why we think it's important to come forward at this time with a summary of where we think health care reform ought to go.
Well, the debate begins. Congressman Dave Camp, Republican from Michigan. Great to have you, Congressman. Thanks so much.
Thanks a lot, Nora.
And President Obama.